Robert, would you be so kind and answer another question?
Sure.
So, what are some things that counselors should or should not do when counseling someone with SSA?
So I tell counselors that if they're counseling a minor, that is a child, someone under 18, they should not counsel them alone. And the reason is that the problems associated with SSA have their origins in the family dynamics. This means that we believe that, of course, homosexuality is not genetic, but that it's caused by the family environment. So anytime I get a request for counseling and the individual is under 18 years old, I recommend family therapy. So one thing they should do is do family therapy. Something a counselor should not do is get into a dual relationship with their client. Often in the case of SSA, pastors especially will feel sorry for the client and maybe try to befriend them. Often as a pastor, there's unavoidable dual relationships because you're pastor and counselor. So those have to be managed very carefully. A pastor cannot talk about the client to other people, for example.
Of course.
Right? So in a church setting, sometimes that's difficult. So the pastor has to take great care as to not to harm the client.
There are some rules that everybody, even if it's a pastor or therapist, everybody should really care about some rules to take care about a patient or just people that we are ministering to.
Exactly. So the counselor has to, or the pastor has to adopt those rules for himself or herself.
Yes. So that is very important. Thank you.